I didn't pay your claim. Definitely not gonna pay your claim. Hang on a second. All these years I've been collecting these rates, and now you know, I just denied all your claims. And I just collect this. You don't need that anymore. Yeah, I tell you now. Alright, pay the good stuff. Yeah, no more free rounds. No more free rounds. Oh, this one's young, that's too bad. Could have got another few years out of this one. Yeah.
Oh!
Shame! Yeah. You couldn't pay anymore anyway, so I'll just take that. Yeah, right here. This is a good one right here.
Shame on you!
I know that. Now you did great. This is kind of a small one. I must have paid a claim on this one. They're going to retire now. Alright, you're done there. Thank you very much. Oh, I stuck one of yours, sorry. Thank you, that's great. Alright.
Shame on you! Boo! What we gotta do? Shame on you! 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 So we're here today to organize, to fight back against those CEOs and those presidents making all that money from Cigna, while people who are struggling and dying and getting sick because they're not getting the coverage they need. So we have a few more people who are here to tell some stories, and then we're going to deliver this pledge and ask Cigna to sign it.
Hi everyone, my name is Benjamin Day. I'm the director of MassCare, the single-payer healthcare organization in Massachusetts. And I'm here because I know what it's like to be denied coverage by an insurance company and get a $6,000 bill in the mail. And when you're most vulnerable and you're trying to recover, that's when you have to fight your insurance company, and it's not right. I also know what it's like to live in England, where everyone gets universal health care as a right. And let me tell you that we need health care as a right in the United States.
Right on.
So a group of us, a delegation of 11 of us, are gonna take this pledge. This pledge, we're asking Cigna not to use our premium dollars to lobby against our access to health care. We're asking them not to deny people with pre-existing conditions, to be responsible participants in our healthcare system, and to let us pass health reform. So we're gonna have Jillian, who's gonna speak as a patient. She's part of our delegation, and Dr. Pat Berger is gonna speak as a physician. And then we're gonna go in, and we are not gonna leave the office until they sign the pledge.
Nowhere near that office, brother.
Sounds better. Hi everybody, I'm Jillian Mason. I'm here from Move On, and I'm also a teacher at a number of the different schools in the area. I teach at UMass Boston, I teach at Boston University, and I teach at Suffolk University. And not a single one of them will give me health insurance for the job that I do. Yeah, so now I'm on a student health insurance plan, and let me tell you, they have refused to cover any further diagnostics for my chronic condition. That leaves me sick, poor, and just screwed. And so basically I'm here today for all those people who can't be, for all those people who are underinsured and who are unable to get the treatment they need because these health insurance companies are too preoccupied with their own profits. So we want Cigna to stop lobbying against the interests of the American people.
Yeah, right on.
Hey.
Hello, my name is Dr. Patricia Downs, and I'm here also supporting MassCare. We have a moral issue here. We have over 48 million people in the United States who do not have health insurance. That means at least 45,000 people are dying each year just because they don't have health care coverage. As a doctor, we try to do the best we can for our patients, but when they don't have any insurance, you can't get tests, you can't send them to the hospital, they can't pay for medications. This is a broken system, And the big problem is the insurance industry. They charge huge premiums each year. They're rising every year. Healthcare is unaffordable. It costs doctors and hospitals huge amounts in overhead for the denied claims. We need to change our system now. We need to get rid of these insurance companies that are hurting people every day.
Get rid of them. Down with the insurance companies.
Right.
Our delegation. All right, everyone in the delegation, let's go this way.
Look! What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Yesterday. Yesterday. Now. Healthcare. Now. Healthcare. Now.
You guys stay here. Alright?
Oh no, he's gonna interrupt. He's part of it. You should probably give your camera to someone.
You guys are on this list?
Yeah, I
Are you
am.
on the list?
Yeah.
1, 2, 3, 4, 5, 6, 7, 8, 9.
You want to meet? Should I give my camera to
Do
somebody?
not write their name on this list.
Oh, I don't have my name on there. Let me write my name.
You don't get no peace. You don't get no peace. You don't get no peace.
If we don't get no health care,
You don't get no peace.
if we don't get no health care,
You don't get no peace.
if we don't get no health care,
You don't get no peace. I know.
if we don't get no health care,
You don't get no peace.
if we don't get no health care,
You don't get no peace.
if we don't get no health care,
You don't get no peace.
You think you should take my
You don't get no peace. Walk right up to
we
it.
don't get no health
All right, let's
care,
go.
You don't get no peace.
we don't get no
Well, I'm going
Why do you let our people die?
Cigna, why do you lie?
Why do you let our people die?
Hey, Cigna, why do you lie?
Why do you let our people die?
Hey, Cigna, why do you lie?
Why do you let our people die?
Hey, Cigna, why do you lie?
Why do you let our
people die.
Why do you let our
People die. Why do you let our people die? Why do you let our people die?
AK, you got my list?
I gave you the what? Who weren't available? We had all 11.
I'd like to keep going and speak with Cigna.
Sorry, we have to advise you to leave right now. If you don't leave, I'm going to place you under arrest, trespassing.
You understand? Everybody understands? All right.
I'm ordering you to leave. If you don't leave, I'm going to place you under arrest for trespassing. Understand?
You understand?
Okay. You're not going to leave?
No.
You're under arrest.
All right.
You're going to have to sit. It's a little too cold for you to sit.
Okay.
Okay, we're going to take you out one at a time.
We're going to start
I'm
from the
gonna-
left and we're going to
I'm gonna check your pockets, make sure you're not carrying anything.
Okay.
You saw your identification here?
I got a driver's license in my pocket.
Okay.
Folks, step away from the bikes, will you, please?
Get my chewing tobacco in there.
Okay. That's on the glove.
Who has the health care box?
Make sure you search them well. Make sure you search them before you put them in the
I do.
You have your medicine with you?
Yeah, I do.
Okay.
All right.
When will you be able to take that medication?
Around 5 o'clock today.
Leave the up and you make it wrong.
Yeah.
All right, let's get this out of the way. Okay?